Today we'll learn the planes of the body. We have few planes in our body through which we move our body. So what are the planes? And what happens in that plane? What kind of movement we do, right? So actually we have three planes in our body. First is sagittal plane. Second is coronal plane, not corona. It's coronal plane, okay, which you can call it frontal plane. I will explain you and show you the picture. And this is transverse plane. So mainly we have three planes. In three planes, we always move our body. Sagittal, you can say medial. Coronal, you can say frontal. And transverse, it is known as axial plane. So you can see here like that. So now, for example, can you see this sagittal plane?
Mm-hmm.
This is the sagittal plane. So what happens, for example, this is a blade. Okay, this book is a blade and this is my body. So somebody comes and puts this blade and upcut, okay, my body into two part. Okay,
Mm-hmm.
and still I'm alive. Okay, and still this blade is between my body, right? So now tell me, still the blade is between my body, as you can see in the picture, the sagittal plane.
Mm-hmm.
Now tell me that can this person move his body side to side? Still blade is there. Can I move my body side to side? No, I think I
Not
cannot.
really. No.
No side movements I can do. Can I twist my body? Blade is still there. Can I twist my body? No, I cannot twist. But what I can do, I can do forward bending and back bending because I can glide between the blades, right? So always
Yeah.
remember in sagittal plane, you do forward bending and back bending.
Okay.
Yes. So all the forward bending and back bending takes place in your medial plane or sagittal plane. Make sense?
Yes.
Yes. And now what are the asana? Just like you do Uttanasana. Okay, you do your wheel pose, back bending. Okay. So these all asanas you are doing in sagittal plane. So for example, you can write down. Okay. You do Paschimottanasana, right? So you
Yeah.
are doing these asanas in your sagittal plane and medial plane. In simple term, you can say medial plane because it is the mid part of the body.
Uh-huh.
Now, the next plane is coronal plane, and it is now famous. Something is famous by the name of coronal plane, and you can call it frontal plane. It means you are dividing front body and back body. Now the blade was between my body, now it will be from side like that, right? So you can see frontal, so it has divided front part and back part. Blade is still there. Now tell me, can I move my body front and back? No,
Mm-hmm.
I cannot because blade is there. Can I twist my body? No, I cannot. But yes, I can glide between. So all the side
Mm-hmm.
movements, okay, side to side movement I can do. So always remember all side movements you do in your frontal plane. Just like you do Trikonasana, your triangle pose, right? So you are doing your triangle pose. In what plane you are doing your triangle pose? You are doing it into frontal plane. Yes.
Yeah.
And when you do this posture, standing twisting posture,
Yeah.
these
Triacted
postures,
asana. Yeah.
yeah. So these posture also you're doing in your frontal plane. So all the side movements takes place in your frontal plane. And now comes your transverse plane. Transverse. So what is transverse plane? When you divide your body from the upper limb and lower limb, you just divide. Okay, you can see it is your just navel point, from navel point. So here now, neither you can do forward and back, nor you can do side to side. Here you can only twist. So all the twisting, okay, Kati Chakrasan, twisting postures. All the twisting
Mm-hmm.
posture you do from transverse plane. So in transverse plane, you are doing twisting posture, just like we have series Asana A, B, C. So we
Mm-hmm.
twist. Okay. So you are doing in transverse plane. So twisting postures will take place in transverse plane. Side to side will take place in coronal plane, and
Coronal.
forward and back bending will take place into your sagittal plane. Clear? Till here?
Yeah.
Yes. Good. So this is the picture you can see: sagittal plane, axial, and coronal. Right?
Mm.
Yes. So here we go. Now we'll talk about movements. Planes. Now these are anatomical movements of the body. So before I go further, I would like to ask question: how many of you are very good at mathematics? Are you good at maths?
Little bit.
Little bit. Okay. That means we should be good. Like no, 2 plus 2 is equals to
Makes
4.
about 4.
You're good. You all are good. Yes. You're good at maths then. So here, very simple mathematics. It's a very simple math. So we know that. So same simple mathematics I'm going to apply here in movement. So here, for example, they allow me, this allows me to draw something. Draw. Okay. So just like tell me, this is a line, right?
Mm-hmm.
And yes, so this is one thing. What is the angle between this line? Angle between this line?
About 90 degree. No, 100 and 180.
Yeah, 180, right?
Yeah.
So it's something like that. Okay.
Yeah.
And if I do this nearby this kind of diagram, so
Uh-huh.
what can be the angle? Now it is decreasing, right? Nearby,
Yeah.
you can say 120.
120
Okay,
around. Yeah.
120. Yes. And if you do this, how much
Around
is
90.
this?
Yeah.
90,
Now 90. Very good. And now this must be
60,
45. Yeah,
45. Yeah,
just take
45.
45 because my drawing is very beautiful. I can see I'm being very good artist here. So same thing, guys. I just request you. Could you just put your elbow, like your hand in front? Just keep at front. Now you have to see the elbow joint, right? Can you see my elbow joint?
Uh-huh.
So here, right now, you can see first thing. What is the angle? It is 180 degree, right?
180. Yeah.
We have 180 degree. Now, if I slightly bend, then it will be 120. If I keep it
120.
here, it will be 45. Yeah,
40,
for 90 degree.
90
And
degree.
if I just do here, and it will be 45
45. Yeah.
nearby. Yeah. So what is happening? You will see the angle is decreasing,
Uh-huh.
right? And from
Yeah.
here, when I open, so if I open like this, so what is happening now? Your angle is increasing.
Increasing. Yeah.
Like that, you are decreasing. Now, when you are opening, again, the angle is increasing. So always remember, whenever the angle between the joints decreases, it is known as flexion. Say flexion of the joint. Now you can
Ah,
see.
okay.
Can you repeat that? You were breaking up on my end.
Yeah, me
Wait,
too.
wait a second. So this. So can you see here? Whenever the angle between the joints decreases, it is known as flexion.
Ah, flexion. Okay, yes.
Yes, flexion of the elbow. Whenever angle is decreasing, and whenever angle is increasing, that is known as extension of the elbow. Right? So here,
Uh-huh.
right now, if I come back, so when I'm opening my hand like that. So what is happening? The angle is increasing from here, 45, 90, 120, and 180. So you would call it flexion of the elbow. Same here with wrist. If you keep your wrist here, so when you palm facing towards you,
Uh-huh.
okay, like anyhow, if you're bending or you're lifting like that, so what is happening? If you see the angle here, the angle is what is happening? It is decreasing. So it is the
Decreasing, yeah.
flexion of your wrist. And when you open like that, so now angle is,
Extension.
yeah, so this is the extension of your wrist. Same
Okay.
with neck. When you're bending your neck like that, front, so it is a flexion of your neck. And when you're bending your neck, looking up, so you're bending, so it is the extension of your neck.
Extension. Okay.
Okay, same with your spine. This is your spine. When you hug someone like that, so tell me what movement you are doing with your spine. You're hugging someone like that, so it is the
Decreasing.
from for
Yes,
Decreasing.
reflection. Yeah.
it's the flexion. Very good. And when you are opening like that, opening your chest,
Now you, yeah. Now it's extension. Yeah.
yeah, now it is extension of your spine, right?
Yeah.
Okay, now if you talk about from hip, if you see from hip, now you're bending forward. So it is a flexion of your hip,
Of the hip. Yeah.
okay, because you are decreasing the angle,
Uh-huh.
right? And always remember in anatomy, we always observe body from front,
Okay.
right? Always observe body from front, not from back, always from front.
Okay.
This thing you have to note it down. So you're bending forward, that is your flexion of the hip. Even
Flexion.
if you lift your leg up, okay, just like if
Uh-huh.
you're lifting your leg up, so it is also flexion of your hip. And
Yeah.
when you take your leg back, so that will be extension
Extension.
of the hip. Just like when you take, just like when you do warrior one,
Uh-huh.
right? So back leg, you will see the angle between the leg, it is increasing, right?
Yeah.
So that is the extension of the hip, right? Yeah. I will
Yeah.
be, we'll do more practicals with asanas later on. So I think it makes sense whenever the angle between the joint increases, that is extension, and decreases, that is flexion.
Mm-hmm.
And when you get more than 180 degree, if just like if I'm just keeping my hand like that, so right now it is around 180, but when it is more than 180 degree, have you ever seen so many people, their this
Yeah.
bone pops up? That is known as hyperextension.
Right.
Okay, so people have hyperextended elbow, they have hyperextended knee. Okay, it is not deformity, it is like they have more flexibility in the joint.
Okay.
People, they think that, oh, I am having some deformity kind of thing. No, you are having flexibility. But you have to understand that when you are performing any posture, you have to be sure that how much bending we require, how much flexion and how much extension we require, right? So we have to be sure. So just like you will see whenever they perform their upward facing dog, right? When they perform their upward facing dog, their elbow come out. And mainly what is recommended, they are recommended that, okay, bend your elbow slightly. Okay, narrow bending. So if you bend like that, so if you bend like that, even means if you are doing upward facing dog, so you will not make the most of it, because you are supposed to keep your elbow straight. So how we can protect joints, and uh, you will observe that they always complain elbow pain, maybe wrist pain, whenever they perform their upward facing dog, even downward facing dog. So how we can help them? Okay, and if we say in downward facing dog slightly bend, then definitely the downward facing dog will not remain the downward facing dog, right? So always remember, if you want to protect your joints, you have to engage your muscles,
Yeah.
right? So joints can be protected after engaging the muscles. So how to engage the muscle, we are going to discuss in the further classes, where I will be teaching you that what commands you can actually give them. Okay, because I need to first of all introduce the muscle topic. So next, this is your flexion and this is extension. Now, for example, I have a soup for you today, right? I have a soup and I'm going to give you. From India, I'm giving you soup. Everybody, take soup. Please keep your hand like that. Yes, take it, take it, take it. Take it. Maria, it is very compulsory for you because you are just woken up. Take everybody. Now feel, tell me, how did you find? Tasty?
Gorgeous.
Gorgeous. Yes. So always remember, whenever your palm facing up, right? Palm facing up, it is known as supination. Whenever your palm is like that, is your supination. Always remember you're holding soup. Supination of the elbow. It is supination of the elbow, right? You can see here, natural, and then here, supination, this.
Okay.
Supination. So whenever your palm facing up, right, it is supination. And when your palm is down like that, your palm is down, it is pronation. You will see this movement is coming from your elbow, right? See, this is coming from here. I'm not using this joint, my shoulder joint. I'm using my elbow. So this is supination. I'm holding soup, right? And I'm palm facing downward. This is pronation. Supination of elbow, pronation of elbow, right? Always remember, OP gave you soup, you took it, but nobody thanked him. Very bad. Yeah, so this is supination and this is pronation.
And pronation.
Yes,
Supination,
supination and pronation.
extension, flexion.
Yes, good. Now, very important, again, one more movement. It is very important. We need to understand that. I think. Okay, this is, you can see how it is looking, how to undo. Wait a second, give me a second to. Everything will go away now. Yes. So you will see, you know, here, can you see his elbow and look at her elbow? That shows that it is hyperextended elbow and it shows it is natural elbow.
Natural elbow. Yeah.
Okay, but yeah, so those are both are beautiful. Yes. So now the next movement we are going to talk is